Hi, my name is Attaya Suvannasankha. I'm a myeloma physician at the Indiana University School of Medicine and also the Simon Cancer Center. I'm also a practicing physician at Indianapolis VA Medical Center in Indianapolis, Indiana. Today, I'm sharing with you the way to measure not only whether the drug works, but also what is the true impact on patients' life using this combination of a drug the combination has just been recently approved. The drugs in the recipe are Belantamab, mafodotin, bortezomib, and dexamethasone. So what is this drug with such a long name? Belantamab mafodotin is an interesting compound that was first actually approved several years back when it was tested in patients with relapsed refractory multiple myeloma. The drug is an antibody conjugate. What it is it's an antibody designed to bind specifically onto the cancer cell, but also it has a linker that attaches this molecule to a toxin. If you imagine what it is, it's an antibody that's carrying toxin with it. When it binds onto the cancer cell, the whole complex gets integrated into the cell. And then the enzyme within the cell chop off that poison, releasing it so that it kills the cancer cells from inside out. Unlike any other chemicals we use, which is typically killing everything it touches and it's outside in. So if you think about what this is, it's delivering toxin just where we want the toxins to be there to kill the cancer cells. Now, I had said that it was already approved a few years back, and then it was removed from the market. What was that story about? Well, it was approved based on what we call accelerated approval, together with dexamethasone. There are some unique side effects of the drug, and that is what we call eye side effect. It turned out that once the cancer cells are dying, they get leaky. That poison gets back out into the bloodstream, and it actually deposits itself in a very small amount in the lining of the eye called cornea. Well, that kind of make the cornea cloudy, and patients then have some blurry visions. They also sometimes have the sensation of irritation, eye dryness. While it seems scary, the key thing is, as long as patients have eye evaluation before their dose and they get the dose delay, if they were having these side effects, everybody's eyes actually return back to the baseline, and patients actually derive benefit from it. So why was it taken from the market? It was really because it was a phase 3 clinical trial that was comparing this drug, Belantamab mafodotin, with pomalidomide and dexamethasone. Well, when you compare two things together, what turned out is we need to set up a bar for how to decide whether it's successful. The drug kind of came close, but not quite crossed that mark, so it was taken away from the market. Now, recently, there's this clinical trial that's combining it. So now it's not used alone anymore, but it's actually used together with bortezomib and dexamethasone. And that clinical trial was comparing this 3-drug regimen with another standard regimen that has bortezomib, dexamethasone, and daratumumab. So that is CD38 antibody. So if you think about what this looks like, it's actually comparing two different antibodies against each other, really. So the Belantamab component was successful, meaning that it led to its approval. So now we have a lot of choices for patients who've had relapsed myeloma who've had at least 2 prior lines of therapy. What does it mean? We wanted to understand, well, how do we think about not just the length of time, but the quality of time? What is the burden to patients? So this study that I'm presenting is assessing what we call quality adjusted life years. So we're asking, based on the life year gain across the multiple drugs we have in that second line, could we take some quality, some burden into the conversation? So that 3-drug recipe is being compared with pomalidomide, bortezomib, dexamethasone, with your carfilzomib, daratumumab, dexamethasone, carfilzomib, dexamethasone, and of course also the bortezomib, dara, and dexamethasone. So it turned out that based on this cross-trial comparison, taking into account the burden of patients, it would appear that this Belantamab, in combination with bortezomib and dexamethasone, actually beat out these other choices in way of burden to patients. Now, This isn't necessarily asking patients which one do you like. This is using modeling to actually help us trying to understand better what's the true value. But this was a pretty encouraging data to say that not only we're offering something that's effective, but hopefully we're also keeping in mind that when people have a lot of choices, they don't always just look at response versus not, but also what will these treatments affect their lives.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.